Welcome, everybody, to Toledo Public Schools Family and School Collaborative. Today, we have the Toledo Public School Health Centers with us today. We wanted to let you know this session is being recorded. And I'd also like to introduce myself. My name is Alina Rodriguez. I'm the Family Engagement and Community Outreach Coordinator for Toledo Public Schools. And we have a special guest with us today. We have Mrs. Tiffany Ways from Toledo Public Schools Health Centers. And I'm going to go ahead and let Tiffany take it away.
All right. Good afternoon. This is Tiffany Ways. I'm going to really quickly get my presentation up and going. All right. Give me 1 minute. Thought I had it figured out beforehand, but here we are stumbling through it. Love the technology. All right. It's just having me share my screen, not my presentation.
Okay, once you share your screen at the very top, do you see the tabs that you can click on?
Yep, there you go. Give me 1 minute. Okay, there we go. Give me a second. I'm trying to put it in presentation. Oh, just lost it again. Sorry, guys. I apologize.
You're okay.
Cancel. Share window. Let's see if we can get it this time. There we go. Yes?
Perfect.
All right, fantastic. Well, thank you for stumbling with me through this process. So I'm Tiffany Ways. I work for Health Partners of Western Ohio, and I oversee our health centers that are located in the 3 of our high schools in TPS. So the focus for Health Partners is to provide integrated primary medical and behavioral health services. And we really focus on, in the Toledo area, on school-based health services. So traditionally, health services are provided, and we're very siloed in our different bubbles. So we have school at the center, and then we have to reach out to primary care, emergency department, medical specialists, behavioral health, and social services. And for us, it's about really having a central location where people can come and get access to services, no matter what age they are. And so for us, the school is kind of the anchor in the community. And so how do we really focus on bringing those services to the community right where the kids and the families are located? So we really use the school as that central point for getting services to everyone. And so Health Partners of Western Ohio, we are a federally qualified health center. And so for us, it's a really huge focus for us just to provide patient-centered integrated healthcare. And part of what we have to do is we do have 51% of the people that are patients for us actually serve on our board. And we really do take great pride in our patients serving on our board and being part of our board and really helping to drive decisions and moving the work forward that we do as an organization. And for us, again, we also take great pride in providing quality services, so high quality integrated healthcare. And so one of the big things that we were recognized for was really being a health disparities reducer. And so we know a lot of our families and lots of individuals don't have access to primary care. And so for us, it's about breaking down those barriers, breaking down those walls, and getting people access to services that are really absolutely necessary for their overall health. And focusing heavily on prevention. How do we prevent things from happening so that way we don't have larger, bigger issues to address later on? And also recognize the PCMH is for patient-centered medical home. So very focused on patient-centered services for people within our community. So who we are, we really do a whole person focus. And so for us, we provide medical services, dental services, behavioral health services, pharmacy. Substance abuse treatment is primarily occurs in our health centers that are located outside of the schools, and our social services. So all of that is wrapped into one location. So when you come to get care with us, you will, I apologize. you will be seeing all multiple providers during your initial visit, because we really want to know all of you, all of who you are, and be able to provide the best quality of care. So again, you will see a medical provider, and as part of that, you will have behavioral health screenings. So really checking on your mental health. How is mental health going? Because the two of them really correlate with each other, and being able to support all of who you are. We'll also check on dental, do dental referrals. We do have a dentist on staff that can get services to you. We're working on getting some dental in schools, so we do dental prevention in schools, and we have pharmacy as well that can do pharmacy deliveries. So as I said, we do universal screenings for all of our patients. Doesn't matter how old you are. You can be 0. We're going to talk to your parents and check on you all the way up through end of life. And so for us, it's really looking at how do we address all of who you are, including your mental health. So as this quote identifies, mental health screenings are a key part of mental health. Approximately 50% of lifetime mental health conditions begin by the age of 14 and 75 by the age of 24. At the same time, the average delay between symptoms first appearance and intervention is approximately 11 years. And for us, that's not acceptable, because so many of our kids and so many of the families that we work with, they really have a hard time getting access. And so for us, it's about breaking down those barriers and getting people access to those services and filling in that gap and serving as that bridge, as identified with NAMI. So welcome to our health centers. I took some pictures. So this is literally a classroom converted into a health center. So this is our Rams Health Center located at Rogers High School. So this is some of the stuff up in the corner that you will see. Nurse practitioner, myself, and our medical assistant. And so when you walk in, you'll see we have our exam rooms. They literally look like a traditional exam room that you would see at a regular primary care office. And then our behavioral health room, which is in the back of our health center at the Rams Health Center. So again, for us, we do provide full service. So full service primary care. We can see you as a primary care office or see you for acute visits if necessary. Big thing for us, we want to make sure you get what you need. And so we can do medication deliveries to home or school, whatever is best for you. So let's say your student is seen at the health center. Like, I'm really concerned. I do think that my student has head lice, or that they have asthma, or they need an EpiPen, or that they have strep or flu. We will get them seen, and then we can have the medications delivered to home, so there isn't a barrier to them getting access to those services and the medications that are necessary. And that's really beneficial because you don't have to miss a bunch of time at work, and the student doesn't have to miss a bunch of time at school. There are some times that the student will have to go home, just like a regular doctor's office. They will have to go home, for example, if they have strep and it's contagious, so they will have to go home. You will be called to pick them up. But then they will go home and medication should be delivered shortly and getting taken care of pretty quickly. So like I said, we have 3 health centers located in Toledo Public Schools. We have Rams Health Center, which is located at Rogers High School. We have Bulldog Health Center, which is located at Scott High School. And we have our partnership with Waite High School. And so that is where we are located as well. We are open Monday through Friday, 7:30 to 4. So literally, a lot of in the past, it's about health centers coming and spending a day, or health staff coming to a school and spending a day there. For us, it's about being there every day and really becoming part of the school and part of the relationship with the students, because they don't get to decide when they're sick. It's like, oh, nope, the doctor's not here on Tuesday. I can't be sick. And so it's about being there every day, embedded in providing those services. And we also have 2 freestanding centers in Toledo. We have our Riverside Community Health Center, which is where our pharmacy is located, and that is where the deliveries come from. And then we have our East Toledo Dental Center, which is where our dental services are. At this point in time, we're also in process of building a very large health center, which is located in the Old West End at the old Girl Scout building, which will be actually our organization's largest health center. We do have 16 sites across the state. But that will be our largest, and we're very excited to be able to provide additional services to the community as we move forward. So again, we have the Rams Health Center, Bulldog Health Center, and the Waite Health Center. So big things for us is, let's say you're a parent and you're like, you know what, I really like to have this checked out for my student. You can give us a call. We can pull the student down while they're at school and have them seen. Or if the student comes down and says, I've had this going on, I really want to be seen, we can give you a call and check with you and make sure that that is okay, that the student is seen as well. Other avenue, teacher or nurse call down and they say, I have a student who came down, I talked to the parent wants them to be seen, and we can see them as well. Another area that we are expanding, like I said, we're in the 3 high schools. Another area we're expanding is doing what is called Title Care Telehealth. And so it's not traditional telehealth like you think, just give the doctor a call or do a Zoom meeting with them. This is literally like laying virtual hands on, where the provider can hear heart and lung sounds. They can look inside of the ear. They can look inside of the mouth. They can check skin, if you have moles or rashes, things like that. They can check out those as well. And so the provider at the Bulldog Health Center will be on the other end of those visits and be able to assess what is going on. And just like at our regular health centers, we will be able to send medications to your home. And these will be happening. We have 25 elementary schools that will be piloting this. Soon as school gets back up and rolling, they will be piloting this in 25 of our schools. And so we're very excited for this opportunity as well, to make sure that all TPS students have access to health services. So this is a little bit about our school-based Title Care Telehealth. Like I said, this is a flyer that you probably will be seeing if you're in one of the schools that we have one of the systems. So if you have a student who has a sore throat, a cough, ear pain, sorry, I'm in one of the health centers and they're getting a little excited out there, a skin rash, eye pain, behavioral health follow-ups. Let's say your child is on medications, ADHD medications, and you literally just cannot get into their primary care. Give us a call and we can support you in that process as well. All right. Another thing that we do, we have COVID testing and COVID vaccines. Our vaccines at this point in time are only available for community members who are age 65 and older. So if you do know somebody who needs a vaccine that is in that age group, please give us a call. Or if they have a chronic health condition, we are also able to get them vaccinated. So we are getting vaccines on a weekly basis. This week we have more than we usually do, so we're very excited about that. So hopefully those numbers continue to increase and we'll be able to continue to provide access to more vaccines. But like I said, we also have COVID testing at all of our sites. Right now, our results are coming back in 2 days. And as I know, we're talking about reintegration and getting back into the schools and getting students back. If you need something related to COVID testing, just give us a call, let us know, and we can get your student tested. And there is no out-of-pocket expense for either the COVID vaccine or the COVID testing. So there is no out-of-pocket expense for that. And we won't have any questions, but one of the other things that I want to mention, I'm going to scroll back to my slide. One of the other things that we do is the service is not free of charge, just to provide clarification. We do bill insurance just like a regular doctor's office. We are a regular doctor's office. Again, we are primary care. So we will bill insurance. We do function on a sliding fee scale if you do not have insurance or your deductible is too high, but you also will never be turned away for your inability to pay for services or medications. So we do want students, staff, and families to be able to get access to all of the services that they need, whether they are able to pay for those services or not. Let's say that you've had a bump, kink, hiccup, and you need assistance with applying for Medicaid, things along those lines. We have staff who can help you in that process as well and work through those challenges or obstacles that you may be facing. So we do want to make sure that people get access to care no matter what is going on for them in their financial world. So we provide services to teachers, students, and family members. So really, if you have any connection to TPS, you're welcome to stop into one of our health centers and you will be seen.
This is excellent, Tiffany. Thank you so much. And I wanted to say we did have a participant join us, so I just want to open it up for any questions. Do you want to open your mic? Do you have any questions for Mrs. Ways?
And there's my contact information.
Greetings, Tiffany. Long time no talk to. How are you?
I am well. How are you?
Good. Hi, Ms. Rodriguez. I don't think we've ever met in person. I'm Skylar. So
Hi, nice to
yeah,
meet you.
I'm Robinson Community Hubs Director. So I met Tiffany before. So no, we just wanted to make sure we had all the information. But is there a way for us to engage our parents about this? We can take the flyer and spread it through Google Classroom, or is there something else?
Yep. So your nurse has all of the current flyers. So if you could connect with your school nurse, we actually were just over there yesterday doing additional training with her in the title care process. So literally your students can have access to health services at any point in time. So they would just go down to the school nurse. Sorry, Dr. Smith walked in. So he's, so they're being a little bit loud out there. I apologize. So what the process is if, let's say, a student comes to school, they haven't been feeling well, or the mom or dad's like, we're going to get them to the doctors, but if you had transportation issues, so on and so forth, they can go down to the school nurse. The school nurse will give us a call and we can see them that same day and get them the medication and services that they need.
Fantastic. Thank you.
Yeah, you're welcome.
That's
And some of the nurses have been saying, like, oh, my student, they need an inhaler and we've never been able to get one, or they need an EpiPen and they've never been able to get one, things along those lines. We are also able to do that and do asthma action plans for the school nurse as well.
Fantastic. Thank you.
You're welcome. Yeah, doing lots of immunizations, lots of sports physicals, lots of work permits. And we generally are able to get people in same day. So stop on over, see us. We really would like to meet you.
This is great. Thank you so much. We appreciate you being here with us today.
You're welcome. And let me know if you have any further questions.
Sounds good. Have a great day.
Thanks, you too.
Thank you, everybody. Bye-bye.